Hi guys, I'm Dr. Tara Tobias. I want to welcome you all back to this channel. In today's home exercise tutorial, we are going to go over a condition called frozen shoulder, or the technical name for it is adhesive capsulitis. So I've talked a little bit in a few videos recently on different causes for shoulder pain after a stroke. This is one condition that I really haven't talked about in any of my videos, and it is pretty common. And actually, when I looked into some of the literature, they say that this is the most prevalent cause of shoulder pain after a stroke, so I thought it would be a good idea to go over that today. But before we dive into that, if you're new to my channel and you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification bell so that you'll get notified every time I upload new videos. And now let's go ahead and dive in. So frozen shoulder, it's a little bit different than some of the other causes of shoulder pain where I talk about spasticity, where really the spastic muscles or the overactive muscles are just pulling the shoulder into a position that could be causing pain, or spasticity can cause a muscle imbalance, which I've talked about, which can affect the way that that arm bone glides inside the socket. So I've talked a little bit about that. So with many of those conditions, the movements that are usually painful are flexing the arm up, especially when the elbow is straight. That's more related to some of those spasticity conditions that I've talked about, where you can really identify specific movements that will reproduce or recreate your pain. Now with frozen shoulder, pretty much all movement causes pain. So regardless of what direction you try and move that arm bone, you usually feel some stiffness and kind of like a dull ache just all around that shoulder. So the muscles may be achy that wrap around that shoulder, but really you can't just put one finger on it. It's really diffuse. So it's really all around that shoulder joint. Now, the one thing that will differentiate a frozen shoulder again from some of those other conditions is with a lot of those other conditions, abducting the arm really isn't that painful. Whereas with a frozen shoulder, typically people want to keep that arm really stuck into their side and they don't really want to move it out to the side. So those might be indications that you are dealing with this, but really it overlaps, or there's a lot of conditions that can mimic some of those symptoms that I just went over. So it's really best to work with a healthcare professional near you to figure out whether or not this is the condition that you are dealing with and that's causing your pain. Now, a couple of other things that I've noticed just in my experience, many times I will see frozen shoulder if someone fell after their stroke and broke their arm bone. And that is because the treatment in almost all the cases I've ever seen where someone has fallen after their stroke and broken their humerus or their arm bone is they just immobilize it. They just tell you to put it in a sling and leave it there until the bone heals. So you really can't use that arm. And that is the number one thing that causes this, is immobilizing the arm. So what happens when you immobilize the shoulder, or you don't move the shoulder for a while, there's a capsule around the shoulder along with ligaments and muscles that help to hold that arm bone in the socket. And when you don't move it for a while, that capsule becomes inflamed and it actually thickens and shortens and almost pulls that arm bone further into the socket. So if you can visualize a trailer attached to a car and you're driving down the road, there needs to be a certain amount of space between that car and that trailer so that it can bend when you go to make turns. Just like the arm bone, there needs to be a certain amount of space between the socket and the ball so that it can move really nice in there and you can get a bend right there. Well, if that capsule shortens, it almost pulls that arm bone or that head too far into that cup, and that's why moving the arm bone will become painful. So now, what is the treatment for this? And this is the important thing, and the reason that I bring it up is if you are dealing with a frozen shoulder, it really is best case scenario if you can work with a therapist. The reason is we're going to go through some stretches today that maybe you haven't seen in some of the other videos, but really it's the capsule that's shortened. And so therapists do joint mobilizations, and there's things where therapists can get right inside that joint and really just stretch that capsule out, which is really hard to do with any of the stretches that I'm going to show you today. Although movement in any direction right now is definitely going to stretch that capsule out a little bit. So I will go through them today so that you can start to do things on your own. But the other thing is that it is a little bit painful, and there's something in us, in humans, in our brains, that will avoid pain at all costs. We're unique creatures in that way. And so being able to do these exercises on your own when you really do need to be able to push through a little bit of pain in order to get that mobility back, it's really hard to do. So I highly encourage you, if you're not working with a physical therapist and you think this might be what's causing your pain, that you definitely try and get in and work with a physical therapist. Some other treatments, there's definitely some medications that you can use to help with the pain a little bit, to make it easier in the early stages to get some of that movement back. So definitely work with your doctor. I've said it in other videos, I really think that a physiatrist is the best doctor for dealing with this type of a condition, for helping you to manage the pain a little bit while you are trying to get that range back. And worst case scenario as far as treatment goes, and the only reason I bring this up is because the number one reason you develop this is from not moving the shoulder. So those of you that are a little bit hesitant to move your shoulder, you really want to, because you don't want to develop this. Worst case scenario is they have to do what they call like a manipulation under anesthesia, which is painful. People think surgery is the magic pill for everything, but surgery is painful. But basically they put you under and they break up some of the scar tissue that develops around there and some of the adhesions. Not only is it painful, if you've had a stroke, surgery is just gonna be more risky than someone who hasn't had a stroke. So if you are someone who can move your shoulder, but you just don't want to because it hurts or it's uncomfortable, move it, because you don't want to develop this. You don't want that capsule to shorten and you lose that range permanently. So the first stretch that you're going to want to do, is called like a pendulum. So you're just going to use gravity and just really gap that shoulder joint, create a little space, and just let the arm hang. So you're going to just lay down on your stomach and just let that arm hang off the side. This is probably the first one, if you're in a lot of pain when you go to move that arm, that is going to be the easiest to tolerate. And then just do little circles, clockwise, counterclockwise. Again, you're just trying to get everything to just lengthen and just kind of using the weight of the arm to stretch that arm. And then the really important ones are abduction, so stretching that arm out to the side. And then I don't really show a lot of internal rotation stretches because for a lot of the spastic patterns and the abnormal movement patterns, you usually have pretty good internal rotation. But if you are developing this internal rotation is really important. So reaching into your back pocket. I like to use a dowel rod for this one, and because you can strap your hand to the dowel rod. And then extension, bringing the arms back. I've showed this in other videos, but I really like this squatting position where you put your arms back on a chair or a couch. If you can't move your arm back there, if you can get someone to help you with this, that would be the best case scenario. And then external rotation is really, really important. I've showed this in other videos, but here's a couple more variations that you can do. And then here's just a few more stretches that I like with a few different positions. So I hope that gave you some good ideas of some stretches that you can do for the shoulder. And then the next step would be to take these into active movement. So once you start to be able to move the arm a little bit and not have so much pain, you really, really want to start doing some active movement. And I've done whole videos on progressions on how to start getting active movement in the shoulder. So I will put links for those in the description below. Definitely do those. But again, if you have frozen shoulder, the key, most important thing are the range of motion activities. Without those and without lengthening that capsule a little bit and getting that mobility back, all the active movement that you want to do and the movement retraining that you want to do is just going to be that much harder. Remember that car and that trailer, if they're too close together, you're going to lose movement. It's going to be harder to get that bend. You need to create space in there. Some other things that might help if you are dealing with pain, especially at night, is positioning. So if you're a side sleeper and you sleep with your non-painful shoulder down and you're getting pain in that top shoulder, best thing you can do is just put a pillow, rest that arm on a pillow. Now, if you're someone that sleeps on your involved side or on your painful shoulder, there's probably not many of you out there, but they do make this great pillow that I'm a huge fan of. It's actually made for side sleeping, and what it does is it creates like a little valley for your shoulder so that all your body weight is not on your shoulder. I will put a link to their website in the description below. But this is another option if you're someone that just really likes to sleep on your side and for some reason you need to sleep on that side or on your painful side. Now, if you're a back sleeper, the best position is what we call like loose pack position of the shoulder, where there's the most slack on all the soft tissue structures around the shoulder. And that loose pack position has your arm just slightly forward and slightly out to the side. So to achieve that, you're just gonna wanna put some pillows underneath your elbow to keep it in that loose pack position. That should help if you're someone that sleeps on your back. And then that is it. Again, it is important to do strengthening exercises in addition to the stretching. I've already done whole videos on that, so I'll put links for those videos in the description below. I hope you found this video helpful. If you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification. Give this video a thumbs up if you liked it and if you want to see more exercises and activities for the shoulder. Keep commenting below. You guys are doing a fabulous job and you guys are answering each other's questions. So I really love that. If you haven't visited the new website yet, you can head over there to get more tips and learn more about your condition. And that is it for today's video. I enjoyed spending time with you all today, and I look forward to seeing you all in the next video.